Whether you have body concerns about your physical appearance or maybe the under-eye bags are driving you nuts, it's time to get your questions answered. Joining me now is patient consultant from La Dermique in Feeding Hills, Kelly Ivy Subak. She's here to answer your questions live on air, 413-377-2001. Call now and you can get your question answered. We're going to start with a viewer question about laser hair removal. She asked if it's permanent.
It very much can be permanent, and it's usually like an 85 to 90% reduction after 6 treatments. There are some things that are involved in that, and that really bears on how effective the treatment is of the machine that you're using and how good the technician is. And if those two things are good, you're good.
You're good.
You're
and
good.
So no matter what, you're going to see a reduction in hair.
Absolutely. You'll never go back to where you started. Most people who have and men of course get the best results, but because they have no major hormonal fluctuations. Yeah. But most women after 6 treatments say that they have no medical conditions underlying will get an 85 to 90% permanent reduction.
Okay, another question that we have is about under-eye bags. No matter what they try, no matter what creams they put on top of their eyes, no matter what makeup they use, it doesn't work for them.
No cream, no makeup is going to take an under-eye bag away. Really what it is a slipped fat pad of the fat pad that used to lie right under here. It's starting to kind of come down a little bit. The one procedure that I have found in 17 years that is non-surgical that has really made a difference in this area is microneedling, which is a non-invasive procedure done with a little pen that has 32 baby little needles on it. There's no pain involved. We numb the area. It's usually 3 to 4 treatments, and it makes a beautiful result after.
So microneedling is this collagen pin?
It's the collagen pin.
So we think of, we hear about these procedures, but we don't always know what type of, there it is right there. We don't always know what it will help us with. So, this is my problem. What do I need to get done to fix it? So microneedling is great for under-eye bags, but it's also great for things like scars.
It does pretty much everything. So it's wrinkles, large pores, scars, stretch marks, laxity in skin. It's kind of been one of these hero products that's come out of nowhere and just blown the whole industry like wide open because the downtime is very, very little opposed to chemical peels or laser resurfacing where you kind of can look like hamburger meat for 3 days. It's that you want to hide in your house. With this procedure, you can go right back to work on Monday or the next day actually. So it's pretty exciting.
So right, exactly. Not very much downtime at all.
At all. And you can put your makeup right over the top of it, or if you're a gentleman, you go back, sunscreen, you back to work the next day.
Another question that we had was someone that had sensitive skin, very, very sensitive, has to use very specific products on their skin, worried about any of these procedures not working for them or being way too harsh. And
that's kind of where I felt my job falls in, putting them under the Visia, the computer that tells me kind of where their vascularity lies, how sensitive are they, and what we can do, and then not going to totally irritate them. That's kind of my job to make sure. But we're working at it from a medical point of view. So we're not doing fluffy, foofy facials. We're there to really cause a medical improvement. So we're not using perfumes, we're not using dyes, we're not using coloring. Our products are medical based and the procedures are to improve their sensitivity. So that is our goal.
Okay, wonderful. And then you work from the beginning to end with them.
All the way through.
All right, we did have a caller on the line. I think we lost them about scar removal, but we weren't able to get their question, but we can still talk about scars, whether it's from when you were a child and it's always been there and you want to remove it. There is help for you, and we've heard of topical creams, but those don't always work.
I mean, if you're getting a scar and it's brand new, and it's a C-section scar or it's an accidental scar, and you're being able to put something like Mederma on it, you are going to make it heal much quicker. But most of us didn't have that when we got our scars, so we're kind of stuck with them. So the procedures that work best is the microneedling or the collagen pen, because we're taking either the depth, we're bringing it up, or if it's a bumpy scar, we're building it down, and we're improving the color, so we can kind of bring it back to where we can't even see it with the human eye.
Amazing.
It is amazing.
You can see it before and after the tremendous results.
It is absolutely
Kelly, we're not done with you. We're going to have you back later on in the show. It's not too late for you to call 413-377-2001 with any question you have about a problem area or concern on your body. We'll be back with Kelly in just a bit. Thanks. We're back with Kelly Ivy Subak from La Dermique in Feeding Hills. She's the patient consultant. She's here to answer your questions live. We've got Marlene on the phone right now. Marlene, what's your question?
Hi. Yeah, my question is, I had a previous liposuction, and I had the incision that I made. I got the scar, and it's also dark on the sides. It got darker on the sides, and I would like to know what can you guys do to get rid of the mark and the dark
Okay, so Marlene, I was able to hear your question. I don't think Kelly was, but Kelly, Marlene's wondering, she has some darkness after she had liposuction. She has darkness on the side. Is that right, Marlene? And
On the spot of the incision.
the spot of the
where they cut.
incision, and she's
Very
wondering
common.
if there's something that can be done to fix that. So Marlene, Kelly will have an answer for you.
Absolutely. It's very common, actually, especially with anybody who has darker skin, some sort of ethnicity. It's very common. It's called post-inflammatory hyperpigmentation. It's caused from the injury. We will usually either treat it with a laser to kind of bring that pigment to the surface and flake it off. If it has texture, we use the collagen pin to get rid of that. And if it's an indent or the texture's off, the doctor will go in and use the cannula from our Smart Lipo because it's very, very tiny, and it will kind of fix any of the older lipo procedures that kind of cause a lot of damage to the tissue.
So the discoloration can be helped.
Absolutely.
Fixed.
Absolutely.
Great.
Yep.
So it's good to know that there's a procedure that can fix something that happened from a previous procedure.
Yeah, I mean, traditional lipo is extremely invasive, so it does cause things like that. So, yeah, it's very common for us to have to fix those.
Marlene, thank you for calling in, and we hope that Kelly was able to answer your question.
Alrighty, thank you so much.
Thank you so much. Have a great day. So actually, continuing with that, we have some other questions from viewers. One person wanted to know if they have to lose weight before they get Smart Lipo done.
Absolutely not. With traditional lipo, they do ask you to lose weight because they're waiting for your own skin to contract because they don't want to take the fat out and then you got a wobbly skin. Nobody wants that. So with Smart Lipo, we're taking the fat out, but because we're using a laser to heat the tissue, it is contracting from the inside. So it doesn't matter. Go out, have your Big Mac, and come in Saturday and have your lipo done.
So whatever you want to eat. Okay.
Whatever. No, you see, you don't have to lose weight. You don't have to worry about any of that.
I think you answered the next question that we had, actually, is someone was wondering if they're going to have a lot of loose skin. So, I mean, you think in your mind, you take the fat away, what about all that skin that's there? Do I have all this loose skin after?
I mean, and there is a point where, yes, there is going to be laxity. And a lot of it has to do with age. If we have a postmenopausal individual, they will take a little bit longer for the skin to contract. But most individuals get an amazing result. We've had patients that were told by other physicians the only thing that was going to help them was a tummy tuck. And it wasn't true. We were able to do it with the Smart Lipo machine and be able to contract the skin from inside. It's pretty amazing with the technology. I mean, within next 10 years, traditional liposuction will probably be a thing of the past.
That's amazing, amazing. All right, we actually have a live caller right now on the line. Hello? Can you hear us?
Yes.
Hi, how are you?
Hi, thank you. I'd like to ask which procedures are suited for people with darker skin, specifically stretch marks.
Stretch marks.
Are those effective for people with darker pigmentation?
It is absolutely. The things you want to avoid are, is anybody kind of take a laser to you? Laser's attracted to pigment, and that's going to heat up, and you can actually get a worse result from that. So you want to do anything that's non-heat related. So things like the collagen pin, microdermabrasion, things that are helping dead skin to exfoliate off, new skin to come up, and kind of decrease that. Really, with that, the collagen pin has been the real hero of that storyline, definitely.
Great, I hope that helped you.
But yes,
It does.
just because you have dark skin does not mean you can't be treated. Absolutely.
Great, thanks for calling in.
Thank you.
That's wonderful. Thank you so much.
Thank you.
Thank you, yes. So you could answer any questions, Kelly, even if they're live and you don't even know what the question is, right?
That's what I do all day long.
Thanks, Kelly. If people can call you with any question they may have. Great to have
Absolutely.
you here, as always. For more information, call 413-786-3376 to get your question answered, or visit ladermique.com. I'm going to toss it over to